Hi, Garcia here, one of the knee and sports surgeons at Orthopedic Specialists of Seattle. Today we're going to show a video testimonial. This is a patient came in, injured their knee, trail running, pretty bad injury, complete avulsion, posterior corner, pulled off some of even the hamstring tendon, some nerve stuff going on, and then also had a tear of their ACL. Now this tear was particular in the sense that there was a lot of ACL still left, and we didn't really want to go through and do a massive reconstruction of both. So we talked about a new, more cutting-edge option, which is an ACL repair. So we did an ACL repair with a posterior lateral corner reconstruction. So still a pretty good-sized surgery. You can see that not only was the less swelling from the ACL repair, but he did amazing from the posterior corner despite the bad injury. Back to sprinting, I mean, literally almost made some thumping sounds in the office with how fast he was running. He's 9.5 months out, and you can see that he's literally this close to going back to pretty much everything, feeling really strong. Exams have been awesome, so hope you enjoy. Thanks.
Went on a trail run and just took a horrible step, worst step of my life, and ruptured my LCL and tore my ACL. And the moment I went down, I kind of knew something horrible had happened. So I was kind of going through the next 10, 12 months of my life and saying, wow, I really just ruined all that. So first time I came to Orthopedic Specialists, kind of saw a general guy, and he felt my leg for about 2 minutes and then said, I'm sending you to someone else because this injury was pretty severe and kind of rare. So at first I was a little worried that I was getting sent to a different specialist, and maybe this was more serious than I had imagined. And I was, talking to Dr. Garcia eventually, going through what would actually, the mechanics of what the surgery would be. Definitely felt daunting. Kind of definitely knew that it was going to be a very involved process on both of our ends, but it felt really good to have clarity on what was going to happen and what recovery was going to take. Yeah, my recovery was long, felt long, but looking back at it, I think I did all the right things. It's really important to do your PT if you end up going to PT. Building strength in my quad definitely was great to see that progress over the time that I put in, but looking back at it, I would say the biggest things are trust the people around you who are telling you to do the right things, hopefully. Build strength, quad and hamstring, super important. And I feel really good about where I'm at, and all the check-ins with Dr. Garcia were great. Yeah, I would say, it's weird to say, but looking back at the whole recovery process, I wouldn't say I prefer that it would happen, but it definitely put me on a path of getting really disciplined about certain things in my life and kind of finding a new perspective, especially on safety and sport and kind of my own limitations. And I think it was actually a very good character building process of going through this, even though, of course, if I had to do it again, I probably wouldn't rupture my LCL. But there are going to be positives to this process if you go about it the right way. And I think having Dr. Garcia on your side is going to set you up for a solid recovery.
And then what can you do now in terms of stuff we had talked about previously?
What am I going to do now?
What can you do from a sports standpoint?
Oh yeah, I think in the next 3 weeks I talked to my PT and I'll be back to sport. I guess I injured myself late November, so this is about a year later, and I'll be able to play volleyball, play basketball. I'm sprinting right now, running. I'm easing back into the things that I have fun doing.
Are you pleased with your outcome?
100%. Yeah, I don't think it could have gone any better.
Awesome. That is amazing. Come back one more time. Go back, go. One more time.